So the next VSV is VSV21, congenital toxoplasmosis. So what is there in the image? Here also you have calcifications, but these are diffuse calcification. They are not particular to particular area. So diffuse calcification, hydrocephalus, chorioretinitis. This triad is seen in congenital toxoplasmosis. So even asymptomatic children can present with hearing loss later. Diagnosis is IgM toxoplasma. Treatment is pyrimethamine sulfadiazine with folinic acid is given as the treatment. This is important. Drug of choice in pregnancy, spiramycin. One more feature you have in toxoplasmosis is the chorioretinitis looks like fog in headlight appearance. Fog in headlight appearance. So which is the congenital infection that presents with hydrocephalus? Congenital toxoplasmosis is the right answer. Coming to the question. An infant presents with macrocephaly, intracranial calcification, chorioretinitis. Macrocephaly is because of what? Because of the hydrocephalus. So this triad is congenital toxoplasmosis. So what is the diagnosis? Option 2, congenital toxoplasmosis is the right answer. Looking at the other options. Congenital CMV, you will have periventricular calcifications. Congenital varicella, what will you have? Congenital varicella, you will have cicatrizing skin lesions. Cicatrizing skin lesions will be seen in case of congenital varicella. And congenital Zika, we will have microcephaly. Anyhow, we are going to discuss about that. So the right answer for this question is option 2, congenital toxoplasmosis. So VSV 22. Please come to VSV 22. Microcephaly, patent ductus arteriosus, cataract. What is the infection? Congenital rubella syndrome. Congenital rubella syndrome is highest transmissibility in the first trimester. As the pregnancy moves on, the infection rate reduces. So most is in the first trimester. What is the triad of congenital rubella syndrome? Deafness, cataract, cardiac defects. Which cardiac defect is most common? PDA. Very important, PDA. After PDA comes pulmonary stenosis. PDA is very important. What is expanded rubella syndrome? When this rubella syndrome is associated with diabetes mellitus and renal manifestation, you call it as expanded rubella syndrome. So the diagnosis is based on rubella IgM. Coming to the question. Classical triad of deafness, cataract, cardiac defects is seen in option 1, no, congenital toxoplasmosis as hydrocephalus, chorioretinitis. So that is not the answer. Congenital rubella, yes, that is the right answer. Option 2. Option 3, CMV, where periventricular calcifications are seen. Herpes, congenital herpes also presents with skin lesions. Okay, it will present with skin lesions. So that is also not the answer. The right answer is option 2, congenital rubella. Okay, going on to VSV 23. VSV 23, what is the image given? There is an Aedes mosquito which is causing infection in the mother. This is causing in utero transmission. So what is this? Zika virus, congenital Zika virus transmitted by Aedes aegypti is the vector. So vertical transmission from the baby, from the mother to the baby is possible. So what are the teratogenic effects? Very important, severe microcephaly. Here the baby will present with severe microcephaly, contractures, congenital contractures and eye abnormality. So if you see a baby with severe microcephaly, vector-borne disorder, you are dealing with a case of congenital Zika. Coming to the question. A newborn presents with severe microcephaly. The mother gives history of fever with rash in the first trimester. Which among the following is the probable transmitting agent? So severe microcephaly means Zika. So they also say that there is a rash in the first trimester in the mother. So it is Zika. What is the causative or vector that is transmitting this infection? It is option 2. Aedes aegypti is the right answer. So the answer is option 2, Aedes aegypti. So move on to VSV24. Move on to VSV24. So VSV24 is another congenital infection, that is congenital syphilis. So what are the images you see here? Some skin manifestations called as pemphigus syphiliticus, okay, and you see nasal discharge, that is called as snuffles. So what is the earliest finding in case of congenital syphilis? Snuffles. What is snuffles? The nasal discharge is called as snuffles, which is infective. Nasal discharge is called as snuffles. So in syphilis, you divide them into early congenital syphilis and late congenital syphilis. Early means the onset will be within first 2 years. Late means the onset will be after 2 years. So early syphilis, snuffles, pemphigus syphiliticus, condylomas and pseudoparalysis of parrot are early syphilis. Late syphilis, frontal bossing, rugates. Rugates is nothing but the skin features that you see around the mouth is called as rugates. Flat nasal bridge, saber tibia. Saber tibia is the bowing of the tibia. Clutton joints, mulberry molars. All these are features of late congenital syphilis. Investigation you do is VDRL. Treatment is crystalline penicillin. Crystalline penicillin. Okay, come to this image. What is seen in this image? You see deafness. So 8th nerve deafness. 8th nerve deafness. Interstitial keratitis. And Hutchinson teeth. This is Hutchinson teeth. What is Hutchinson teeth? The notched incisors are called as Hutchinson teeth. The triad of 8th nerve deafness, interstitial keratitis, Hutchinson teeth is called as Hutchinson triad. This is called as Hutchinson triad, which is seen in late congenital syphilis. Seen in late congenital syphilis. Okay, so this is about congenital syphilis, Hutchinson triad, late syphilis. So coming to the question, a child presents with feature of late congenital syphilis. Which among the following is not a feature, which is not a feature of late syphilis? Saber tibia, yes, it is a feature of late syphilis. Hutchinson triad, yes, it is a feature of late syphilis. Snuffles, snuffles is a feature of early syphilis, early congenital syphilis. Rugates is also a feature of late congenital syphilis. So the answer for this question is option 3, snuffles, which is a feature of early congenital syphilis. Moving on to the next VSV, VSV25. So please go on to VSV25. What is seen in VSV25? You see a lesion in the oral mucosa opposite to the lower second molar, that is called as Koplik spot. You see a maculopapular rash on the body. So the diagnosis we are going to see is measles. The diagnosis is measles. So measles is caused by paramyxovirus. You will have a characteristic feature of fever with 3 C's. What are the 3 C's? Cough, coryza, conjunctivitis. Cough, coryza, conjunctivitis are the 3 C's. So what is the oral mucosal lesion? You see Koplik spot, where opposite to the lower second molar. It is the pathognomic feature of measles, present on day 2 or day 3. So you will have a rash which typically starts behind the ears and spreads to the tongue. 2 important MCQs. Most common complication of measles is otitis media. Most common cause of measles is pneumonia. Most common cause is pneumonia. So this pneumonia is also called as H pneumonia. It's also called as H pneumonia, which is a giant cell pneumonitis. It is a giant cell pneumonia. Last thing, what is the delayed manifestation of measles called as? Delayed complication of measles is called as SSPE. Delayed complication is SSPE. So this is about measles. Okay. Now, coming to the question. A child presents with fever, cough, coryza and conjunctival congestion. So fever with 3 C's. The diagnosis is measles. Which among the following is the most common complication? What is the most common complication of measles? Otitis media. Yes. So the answer is option 3, otitis.